The number of COVID-19 cases in South Korea has topped 10,000 on Friday. On the bright side, though, roughly 60% have already recovered from the virus. Yoon Jung-min has our top story.
The total number of COVID-19 infections in South Korea climbed to over 10,000 on Friday, 74 days after the country reported its first case. South Korea reported 86 new cases as of midnight Friday, bringing the total to 10,062. Most of the new cases were from Gyeonggi-do Province, due mostly to a cluster infection at a hospital in Uijeongbu. Seoul added 18 more cases, mostly imported cases from abroad. And 22 people tested positive at airports upon arrival to Korea. South Korea's southeastern regions of Daegu and Gyeongsangbuk-do Province, which had been hit hard by the outbreak, saw new infections in the single digits. Some 6,000 people have recovered from the virus as of Friday and have been released from self-quarantine. As of Thursday, the total number of people under self-isolation in South Korea reached some 27,000. Almost 20,000 of those were in quarantine after arriving from overseas. From April, the government has been quarantining foreign visitors at designated facilities if they are staying here only for a short period of time. Currently, 266 people are isolated at those facilities. On Friday, Daegu health authorities said 25 more infection cases were reported at local hospitals. A cluster infection of 22 new cases was reported from a psychiatric hospital in Daegu. On the same day, an internal medicine doctor was confirmed dead after having tested positive for the coronavirus last month. This is the first time that a medical worker has died from the virus in South Korea. The doctor reportedly had contact with an infected patient. The new cases reported on Friday will be reflected in the official tally from the Korea Centers for Disease Control and Prevention on Saturday. Yoon Jung-min, Arirang News.